Hi, my name is Jade Cole. I'm a first year nursing student with the SCBSCN program, and I have completed my COVID screening.
My name is Maya Keith, and I consent to this video for educational purposes, and I also have completed my COVID screening.
I'm now going to begin the assessment with my general survey. Hi, my name is Jade. I'll be your first year nursing student. Can you tell me your name and your date of birth, please?
My name is Maya, and my date of birth is May 23rd, 2003.
And can you tell me where you are right now?
At your house.
Patient is alert and orientated ×3. I'm now going to begin with the physical appearance. Patient is well groomed, dressed appropriately for the weather and for the procedure. Skin color is consistent throughout, hair is brushed and a ponytail. I'll now move on to body structure. Patient is sitting comfortably on the table with her arms in her laps. No physical deformities noted, and she is an appropriate weight and height for her age. Next is mobility. If I can just get you to stand up and walk back and then walk this way. Assessing the patient's gait. Gait is well balanced, smooth, and even with a symmetrical arm swing. And lastly, I'll be moving on to behavior. Patient maintained eye contact throughout the assessment and was comfortable and cooperative, and her speech was clear. Now I'm going to begin with my subjective questions. Have you been experiencing any pain or nausea?
No.
And have you been noticing any pain, cramping in your abdominal area as well?
No, not really.
Okay. And now my subjective questions for the peripheral system. Have you noticed any swelling in your extremities?
A little bit in my lower legs.
In your lower leg, okay. And are you on any medication for that?
No.
No? Okay. I'm now going to move on to the inspection of the lower extremities. If I can just get you to lay your legs on the table for me, please. I'm going to inspect the lower extremities for skin color. Skin color is consistent throughout both legs, and also symmetry. So are both legs the same size, which they are. Also going to look for hair distribution. Not much hair on the legs, but I can see the pores and the hair follicles are nicely evenly distributed throughout the legs. And I do notice a little bit of swelling in her right leg from her knee to her toes. And now I can move on to palpation. So I'm going to palpate the legs for temperature. Patient is warm to the touch. Also for texture, and also feeling for any lumps or bumps, which I do not feel. Now I'm going to feel for any edema. I do notice some pitting edema in her right leg. It would be about a +1 pitting. Now I'm going to check for skin turgor. Skin was replaced at a normal rate. And now for cap refills. Refills were filled in about 3 seconds, which is what we want. So through my inspection of the patient, I note that the patient has a mild bilateral edema in her leg, from her knee to her toes. I'm now going to move on to the pulses, starting with the popliteal pulse. Making sure when you're doing your pulse, you're listening for a full 60-second and always listening for the rate, rhythm, and amplitude. Okay, Rate was normal between the 60 and 100 beats per minute. Amplitude was about +2 and rhythm was normal. Now moving on to the dorsalis pedis pulse. Again, rate was between 60 and 100 beats per minute. Rhythm was normal and our amplitude was about +2. And lastly, moving on to the posterior tibialis pulse. And again, rate was between 60 and 100 beats per minute. Rhythm was normal and our amplitude was +2. If you cannot find these pulses, you can always use a Doppler to help you out and find the pulses. I will now move on to inspection of the abdomen. When inspecting the abdomen, I want to look for, just like that. I want to look for contour, symmetry, making sure that both sides are symmetrical. Again, hair distribution on the abdomen. And I also want to look at the umbilicus, making sure that it's even and that there's any abnormalities with that. Next, you want to move on to your auscultation before your palpation. When auscultating, I'm going to start in the right lower quadrant, working my way clockwise around the abdomen, listening in two places. I want to hear normal sounds, but I'm also going to listen for hyperactive and hypoactive sounds. When listening to the abdomen, no hyperactive or hypoactive sounds were noted, only normal bowel sounds. And you also want to remember to use the bell of the stethoscope to go back over and listen for any bruits or vascular sounds in the abdomen. And I can now move on to my palpation of the abdomen. Again, palpating starting in the right lower quadrant, working my ways clockwise around the abdomen. I'm going to use 4 fingers and only do a light palpation about 1 centimeters deep in the abdomen, feeling for any lumps or bumps, and if the patient has any pain. I want you to tell me if you have any pain when feeling your abdomen, okay? Okay. Starting in the right lower quadrant. And working my way around the abdomen. No lumps and bumps were noted, and the patient did not express any type of pain when palpating the abdomen. I will now make sure to document all my findings and how the patient tolerated the assessment. Thank you for watching.